Hello and welcome to Wellness Wednesday Live. I am Bethany Zell. I'm the Program Director for Healthy You at Cary Medical Center. And I am here today with Jen Dickinson, who is a physical therapist. She is our Rehab Lead at Cary Medical Center. Hello.
Hello, thank you.
And we are here today on the Cary Medical Center Facebook page because this month, our Healthy You Facebook page, where we normally do these Wellness Wednesday Lives, is being occupied by our virtual health fair. So if you haven't checked out our virtual health fair, you still have a few days left to catch up with all of the exhibits that have already been put out. And we have a few more that'll be rolled out just in the next couple days as we wrap up October. But today we are here to talk about physical therapy, which is Jen's area of expertise. And we're doing this because this month is National Physical Therapy Month. So we wanted to sit down with you, Jen, to just learn a little more about your job and what you do and how physical therapists help. So why don't we start with you telling us a little bit about what physical therapy is? What is it exactly? What do you do?
A lot of people think of us as massage or just a lot of exercises and personal training types of things, but there's a lot that goes into it. We like to think of it as though physical therapy is a study of how we move. And expertise in how we move. So we look into all the different body systems, your muscles, your joints, tendons, your nerves, even heart and lungs and endocrine system. And we put information from all of those together and also look at how people are moving, their posture. We look for faulty ways that they move. And we try to use all that information to then try to retrain it so that they're moving with better posture or things are well balanced.
And just as you're saying that, it makes me want to sit up tall. She's probably seeing how much I'm slouching right here. So what kind of training do you need to be a physical therapist? What kind of certification does that involve?
Yeah, so now everyone who comes out of PT school gets a doctor of physical therapy degree.
Nice.
So it depends on how the school structures that, but generally they've gone through their undergraduate degree ahead of time and they apply to PT school. And then they go 3 to 4 years, which includes study of all the different body systems, how they interact, and then also a lot of clinical hours where they get hands-on training in different settings.
So you're saying 3 to 4 years beyond the standard bachelor degree?
Right.
Wow.
Yeah.
That's a big commitment.
Yeah.
Well, thank you for being so committed to that work. So what kinds of issues or prevention of them can physical therapy help with?
So the typical would be your sprains and strains and muscle and tendon problems. We do a lot of joint care, so we focus in on a certain region of the body, like your shoulder or your knee, neck and back, hips, ankles and feet, that kind of thing. But then there's also physical therapists who focus more on cardiopulmonary issues or on vestibular, such as vertigo or dizziness. We have a therapist here who does lymphedema treatment, and she also does oncology rehabilitation, so she works with the cancer population. There's a little bit of crossover between the two. What else? We can look at kind of another thing that we've targeted lately here is looking at fall prevention and trying to find out a risk for someone for falls and ways that we can prevent it.
That's awesome, and especially as we move into the winter months with some of the icier conditions up here in Aroostook County, fall prevention is essential. Mm-hmm. And definitely I'm sure it helps with balance as you're going through some of these physical therapy protocols. That's awesome. So how can people access physical therapy? Do they have to go through their primary care provider? Can they just say, I think I need help with this, and contact them and get a referral, or can they come directly to you?
Generally, it works best if they go through their primary care provider or a specialist or that for whatever they're being seen for. Technically, we do have direct access in Maine, but a lot of insurances don't reimburse for that.
Right.
So it works best to still get a referral ahead of time and then set it up through your doctor.
So what if someone is dealing with some soreness that might have been a residual from something that happened to them years ago? Mm-hmm. Is it too late for them to start PT? Could they benefit from coming in even though they've been dealing with it for a super long time?
Yeah, we do see people with a lot of chronic types of conditions, a lot of neck and back pain that are chronic. and then different joint areas too, shoulders and knees. There are times where it's gone on long enough that we might not be able to fully rehabilitate what's going on, but at least we can give them some tools to be able to manage their pain better, hopefully feel a little bit better, and maybe make them safer if they're, having balance or fall types of issues or,
Awesome. So it's not too late. So if you are experiencing some kind of pain, it may not be 100% correctable, but you might get some tools that'll help you be at least a little more comfortable as you go forward. That's awesome. And I guess as we wrap up, maybe just tell us, as a physical therapist, obviously you're involved in health and wellness overarchingly, and you're concerned about your patients and your clients who are coming in with these issues. So as just a normal person who's concerned about health and wellness, what is something you think is important for people to really focus on to maintain and sustain their physical health?
Yeah, well, I think the obvious would be just to stay active. A lot of times, especially with winter coming, it becomes a little bit harder to do that, but trying to be creative in finding ways to stay active and keep your strength, keep your flexibility and your endurance up. I think a really big one is to think about how you do things. So, walking with good posture, doing your activity with good posture, because your form and your posture really help you use the correct muscles and keep things balanced. And if people are doing things with poor posture, a lot of times that leads to imbalances and pain and other issues.
Awesome. All right. Well, thank you so much. Do you have anything else you'd like to add?
No, that's good.
Awesome. Well, we appreciate your time, and we appreciate all of you watching us live. We hope you'll tune back in. We've got some other great Wellness Wednesday lives scheduled for November and December. We're here on the 2nd and the 4th Wednesday of every month at 1 p.m. And we'll be back on the Healthy You page in November. But if you've missed any of them, you can see them all on the Healthy You YouTube channel, and we'll link that in the comments. So thanks again for your time, and have a great day.